What's up YouTube, my name is Jimmy and welcome to my channel Envisage. On today's lesson, we will discuss the clinical manifestation of kidney as well as the treatment options for those clinical manifestations. And finally, we will utilize the pool as a theme for the drug acronym of those clinical manifestations. We will utilize the pool as well as the vacuum to envision the kidney. The kidney has two main functions, which includes filtration as well as hormone production and conversion. So if we look at the kid in our example, the vacuum can actually be visualized as a continuous filter system that filters small particle, kind of like how a kidney will filtrate electrolyte and sugar. The water in the pool can be envisioned as the interstitial fluid, and the small algae can be seen as precipitates when there could be abundance of phosphate, which has the higher probability to bind to calcium to form precipitate, as well as the excess toxins in our body. So the main electrolyte balance happens at the loop of Henle via the mechanism of countercurrent multiplication, and most of the sugar reabsorption happens at the proximal tubule of the kidney. The kidney also plays a role in secreting hormones such as erythropoietin and renin. Erythropoietin helps increase red blood cell production, and the stimulation of renin helps manage both potassium as well as sodium through the process known as the RAS system. The RAS is known as renin-angiotensin-aldosterone system. As a result, renin plays a huge role in the regulation of blood pressure. And finally, the kidney converts the vitamin D to the more active form to help calcium absorption. Let's now look at the different clinical manifestation of the kidney. We can separate the kidney clinical manifestation into two different components: the filtration component as well as the production and the conversion of hormones of kidneys. For the filtration process, if the kidney is impaired, then there could be an imbalance of electrolyte, which could result in too much potassium or too much phosphate, known as hyperkalemia or hyperphosphatemia. Too much phosphate may lead to an increase in kidney stones as well. Also, the impaired kidney can also lead to the improper excretion of medication. For the production and conversion of hormone, the lack of conversion to the active form of vitamin D may lead to the lack of absorption of calcium, which in the long term may result in the prevalence of osteoporosis. The decrease of GFR is also associated with secondary hypothyroidism, and this is thought to be due to the less excretion of iodide, which results in the increased uptake of iodide by the thyroid gland, and as a result, blocks the thyroid gland from making thyroid hormone. And finally, the decrease in erythropoietin may lead to the decrease in the production of red blood cell, which ultimately leads to anemia. And finally, we will utilize the vacuum as an acronym to extrapolate the pharmacological therapy utilized in the clinical manifestation of the kidney disease. We will utilize the word VAC for both the clinical manifestation of impaired effects of the filtration, as well as the lack of conversion to the active form of vitamin D. For hyperphosphatemia, if we read the word from right to left, we can actually extrapolate all the phosphate binders. We get the V for vacant, or otherwise known as free aluminum and calcium, which includes ferric citrate, cevalamine carbonate, and cevalamine hydrochloride. A for aluminum, and C for calcium. For vitamin D deficiency, if we read the word VAC from left to right, we get the word calcium analog vitamin D. Calcium vitamin D analog comes in two different forms: ergocalciferol and cholecalciferol. D2 is ergocalciferol and D3 is cholecalciferol. And a good way to remember the difference between those two analogs is that C for cholecalciferol is the third letter of the alphabet, so it is vitamin D3. And the difference between vitamin D3 and D2 is that vitamin D3 appears to be more potent than vitamin D2. To note, there is an off-label indication for Jardiance, which is used in patients with chronic kidney disease as a secondary agent with or without diabetes as of November 2022. And this we would discuss in a later video. Thank you for watching. Please comment below and let me know what other videos you'd like to see next. As always, let's continue to empower a different way to achieving success. I'll see you guys in the next one.